Good morning, everyone, and welcome to the WellMed Charitable Foundation Caregiver Teleconnection Series. Today we have toileting, incontinence, and dementia with Lucy Barylak, who's a social worker. She received her master's degree in social work from McGill University and has dedicated her career to supporting caregivers. Lucy was the founder and longstanding manager of the Caregiver Support Center, a multi-service respite program for family caregivers. In 2003 and 2012, she received the Queen's Jubilee Award presented by the Canadian Home Care Association for her dedication in developing a national coalition to support the issues and challenges facing family caregivers. She has published numerous articles and has presented at major conferences on her research findings. She's also a liaison supervisor at the School of Social Work at McGill University. So, Lucy, thank you for taking your time to be with us today. And please go ahead. Um,
Thank you, Evelyn, and thank you, Minerva. I also want to say that I was a caregiver for my mother for over 10 years, and that's something that I would like to share. So, thank you. Good morning, everybody. Today, I will be speaking about a taboo subject, dementia and toileting, a subject that was identified to me by many caregivers who are caring for someone with dementia, as well as what the research tells us about this particular topic. Many of them were embarrassed to ask certain questions. For example, one of my caregivers said to me, wiping my husband after he uses the toilet is very difficult for me to perform. Am I a bad person? In another example, I really feel very embarrassed to tell my mother that she needs to wipe herself. It appears that she is embarrassed to do so in front of me. I know that if I don't watch her, she will not do the task, and I'm concerned about infection. How do I handle it? As I said, this is a taboo subject because it makes people feel uncomfortable and embarrassed. So what I want to tell you that today is an open discussion. No questions or remark are problematic. The topic is very important and needs to be addressed. You're going to have an opportunity to do that after my presentation. I'm going to keep a lot of time open for you. So let's go to the next slide and take a look at the agenda for today. So I'm going to talk about understanding dementia and toilet issues because they're a little bit different than just dementia. What causes toilet problems and incontinence? What are the risk factors for someone who suffers from incontinence? And tips on how to manage it. What caregivers need to do for themselves. So I'm really talking about two subjects, incontinence, but I'm also wanting to talk about what you have to do in caring for yourself. You know, incontinence in people with dementia is one of the factors that are associated with the decision to move the person into a home care. Managing incontinence adds to the caregiver burden and has been reported by family caregivers as more difficult to manage than the behavioral symptoms of the dementia. But it does not have to be so. Many caregivers and their loved ones can remain at home with incontinence issues if the caregiver has the tools, the information, education, and the ability to manage this issue that maintains the person's dignity as well as the caregiver's satisfaction in caring for the person at home. But I do want to say that it's not for everyone. And if you're at the point where you feel you can't continue doing it, it's okay. I give you permission. We'll talk a little bit more about that. In general, caregiving can be extremely rewarding, and I know it on a personal level, excuse me, but very challenging as well, and we know that. Donna Shep is a nurse who wrote a very interesting article in the Nursing Journal, and she said, whether you become a caregiver gradually or all of a sudden due to a crisis, or whether you are a caregiver willingly or by default, many emotions surface when you take on the job of caregiving. Some of these feelings happen, right away, and some don't surface until you have been caregiving for a while. Whatever your situation, it's important to remember that you too are important. All of your emotions, good or bad, about caregiving are not only allowed, but valid and justified. Many feelings come up when you're caring for someone day in and day out. Many caregivers set out saying, "This won't happen to me. I love my mother, my father, my husband, my wife, my sister, brother, friend, etc." But after a while, the negative emotions that we tend to want to bury or pretend we aren't feeling come up. Caregivers are often reluctant to express their negative feelings for fear that they will be judged by others or that you will judge yourself, or don't want to burden others with their problems. So here are some emotions that you may be feeling. So have a listen. Doesn't mean that you do. And maybe you just feel a few of them or not at all. There's ambivalence. There could be anger, anxiety, boredom, a crankiness, irritability, depression, sadness, disgust, embarrassment, fear, frustration, grief, impatience, jealousy, why me, lack of appreciation, lonely, lost, resentment, and being extremely tired. So what I want to tell you that it's okay to feel some of these emotions. You're only human. I will elaborate more on how and what you need to do to manage your emotions. Now, this is very important. Firstly, when dealing with issues of incontinence, it's important to rule out health reasons that may have little or nothing to do with the dementia. Difficulty going to the bathroom can be a sign of an urinary tract infection, a dietary or hydration issue, not eating enough healthy, easily digested food, or drinking enough water. Possibly a problem in men could be prostrate or side effects from medications. This is important to keep in mind. I'll give you an example. Sleeping pills, for example, can cause incontinence, even if they're prescribed by your doctor. So it's very important to consult with your loved one's doctor to be sure that none of these are factors that are causing the incontinence. So if it's happening now and they haven't seen their doctor in a while, please make sure to go and have an appointment. However, it's common for people who have more difficulty using the toilet as they get older, particularly if they have dementia. Accidents and incontinence can cause problems, especially as people as conditions deteriorate. This can be upsetting for the person with dementia and difficult when you're supporting them. Many people find it difficult to talk about these issues. However, support is available. With the right help and advice. Incontinence and toilet problems can be managed or sometimes even prevented. What I want to say is that experienced toilet problems and incontinence can be challenging for the caregiver and for the person you are caring for. It certainly requires lots of patience, understanding, and compassionate approach. So I want to talk a little bit about understanding dementia and toilet issues. Why is this an issue for people with dementia? So toileting refers to an individual's ability to independently get to the toilet, use it properly, and clean themselves effectively. Although this is second nature for most people, dementia people face a variety of challenges that interfere with their ability to use the toilet. There are several types of incontinence that have different underlying causes, but dementia patients typically experience their functional incontinence primarily a loss of bladder or bowel control due to the inability to get to the bathroom or use it properly. Cognitive deficit causes toilet difficulties because the individual does not recognize the urge to go, can communicate their needs, has difficulty accessing the restroom, and can't remember the toileting process. All right? So it's very important to keep all that in mind. Can we go to the next slide, please? Okay, so what causes toilet problems and incontinence? So obviously, remembering that every individual with dementia is unique and strategies that work for one person might not work for another. So, what is important is to really be flexible, adaptable, and compassion are crucial aspects of caregiving in such a situation. So, we know that people with dementia have cognitive impairment. Dementia affects cognitive functioning, including the ability to recognize and respond to bodily cues. Individuals may not be able to recognize the sensation of needing to use the toilet. Communication challenges. As dementia progresses, communication skills deteriorate. The person may have difficulty expressing their needs to use the bathroom or understanding instructions from you. Mobility issues. Dementia can lead to physical limitations, making it challenging for individuals to reach the bathroom in time. Now we know that there's memory loss. Forgetfulness can cause individuals to forget where the bathroom is located or to forget that they need to use it. Sensory changes you have to take into consideration. Dementia can alter sensory perception, making it harder for individuals to recognize the sensation of a full bladder or a bowel. Medication side effects, I talked about that. This is important. Some medications used to manage dementia symptoms or other health conditions can affect bladder and bowel control. Even meds over the counter. That's why I always say before you buy anything for someone with dementia or yourself, please speak to the pharmacist. Now, there could be physical health conditions, underlying health issues such as urinary tract infection, constipation, or prostate problems in men can contribute to incontinence. Now, the other thing that also is to keep in mind anxiety and stress, changes in routine, unfamiliar environment, and the presence even of a caregiver can cause anxiety, which may impact a person's ability to control their bladder and their bowel. Lack of awareness. People with dementia might not be aware of the consequences of their actions leading to accidents. They don't even know that it's actually even happening. Loss of inhibition. Dementia can lead to a loss of social inhibitions, causing some individuals to exhibit behaviors they wouldn't have in the past, including inappropriate urination or defecation. Altered perception of time. They might be sleeping all day or they're up all night. A distorted sense of time can affect an individual's ability to wait for the appropriate time to use the toilet. So I'm telling you an awful lot of things, and I hope you're taking it all in because you will have a chance to really express yourself and talk a little bit more deeply with it in a little while. The unfortunate thing is, as the dementia progresses, there can be increased deterioration, even in familiar settings. They may tend to get confused more easily while carrying out multi-step processes to go to the bathroom. A senior with dementia may forget where the bathroom is located in their own home, what the toilet is for, and the steps needed to prepare to go to the toilet. This can result in a dementia patient failing to look and get to the bathroom in time, struggling to remove their and put on their clothes, urinating or defecating in places that you would think, how the heck are they doing this? This is terrible. But this all has to do with their dementia. They're not being able to even recognize or know what they're doing. Let's go to the next slide. Now, here you have, you're caring for this person, you're having a hard time managing the incontinence. I do want to touch a little bit on the risk factors of someone who suffers from incontinence. There's a lot of work that's associated. It's not just getting them to the bathroom. Incontinence can cause several risks and challenges in individuals who experience it. The impact of these risks can be, based on the severity of the incontinence and underlying causes and the person overall's health. So let's look at that. So there could be skin issues. Prolonged exposure to urine or feces can lead to skin irritations, rashes, and even more serious conditions like bed sores, ulcers. The constant moisture can weaken the skin protective barrier. Urinary tract infection, I talked about that. That can definitely increase bacteria. If they're incontinent, bacteria can get into the urinary tract more easily. When there's leakage, leading to infections that can cause discomfort and require medical treatment. One of the things that people don't think about, the whole idea of social isolation and embarrassment. Incontinence can cause embarrassment and anxiety, leading individuals to avoid social interactions and potentially isolating themselves from others. Not just the person themselves, but even the caregivers feeling embarrassed to take them out. Reduced quality of life, the physical discomfort, emotional distress, and limitations on daily activities that incontinence can cause may lead to a reduced overall quality of life. The other one that we really need to think about is fall risk. Frequent trips to the bathroom or the need to use mobility aids while, like walkers, while rushing to the bathroom can increase the risk of falls, particularly in older adults. Psychological impact. Incontinence can lead to feelings of shame, frustration, loss of self esteem. It may contribute to mental health issues like depression and anxiety. Compromised immune hygiene. Individuals may struggle to maintain proper hygiene due to challenges with cleaning themselves after accidents. Dehydration. Some individuals intentionally reduce their fluid intake to minimize the frequency of bathroom trips, which can lead to dehydration and its associated health risks. Sleep disturbance. Bedwetting can disrupt sleep patterns, leading to poor sleep quality and daytime tiredness. Cognitive functioning decline. Individuals' cognitive impairments such as dementia, the ability to recognize, as I said. So all these things are taken into consideration. Now, here you are, there's caregiver burden, and incontinence can be physically demanding and emotionally challenging for caregivers, potentially contributing to caregiver stress and burnout. Financial cost. Managing incontinence can involve purchasing protective pads like adult briefs, bedpans, skincare, additional medical treatments and interventions that can be costly. Malnutrition, believe it or not, that's what the research is. The need to rush to the bathroom or the embarrassment of incontinence can lead to skipping meals or not eating frequently. So all these things are really, really very, very cumbersome. They're difficult. They're emotionally draining. And even though I said that I would take some questions at the end, I'm just wondering if there are any questions now. I can take a little bit of pause before we continue to look at tips that I would like to give you. So let's open it up. You're on mute, Evelyn.
Blah, 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 the talking head. If you're on the phone, you can press *6, and I will be able to see on my little website here that you have done that and can call upon you by your prefix. And if you're on Zoom, you can unmute yourself or you can put something in chat right now because we would love to hear from you. We've got a ways to go here. And one of the things that happens is that we often have people who ask questions that she's going to answer in a little bit. So if we don't get to your question right away, don't worry, we'll get to it eventually. Okay, I don't see anything, Sue Lucy.
Okay, so I guess people are just taking it all in.
Yeah, well, it's a lot.
It's a lot to take in, you know. The idea behind all of this is that just being a caregiver and doing everyday caregiving duties to someone with dementia, and then on top of it, having to deal with incontinence is sometimes over the top. And I think it's important for caregivers to recognize their limitations. Because I always say that there's two people in this relationship, right? One does not outweigh the other. You do not put yourself in a situation where you become sick. So that's why it is I did say a lot, but these are all of the reasons that just an everyday situation when someone is incontinent, that's what you have to go through. Okay, so since there's no questions, we can continue and go to the next slide, please. And this is where we start talking about tips, okay? What you need to do. So what I want to say, like bathing and showering, difficulty using the toilet can be intimate and embarrassing and presents real challenge for people with dementia and their caregivers. The best way to approach toileting problems for someone with dementia is to take the following steps toward an easier, less emotional experience. But remember what I said, it works for some people and not necessarily for others. But if one tip helps you, I'm happy. Make sure, again, I'm emphasizing, make sure that you eliminated any medical problems that this person may have and that they did see their doctor and that dementia is the reason why they're having these problems. Okay? So, what you first and foremost need to do is to set up the bathroom to make it as easily as possible for the person to get in. Okay, and really to make sure that there's no clutter in the house before they enter the bathroom, that things are really in place. And it's really really important to make sure that they have a raised toilet seat and grab bars. One of the things, this is a suggestion that a caregiver gave to me, put a picture of a toilet on the bathroom door. Hopefully, they will recognize the picture, okay? Because they might not remember the door. And as I said, make sure that the path is clean, there's no scattered rugs around, nothing around so that they can easily get in and be comfortable. Now, the other thing is gentle reminders. Preventing toilet issues may be as simple as reminding your loved one to use the bathroom every 2 to 4 hours. That's what the research recommends, not necessarily only me. An occasional prompt can get your loved one up and headed to the bathroom. And then there's a good idea, it's a good idea to check that the toilet was used and that your loved one didn't get distracted or have an accident. Smart drinking. Limit the amount of liquid your loved one drinks during bed or to reduce the need to for nighttime bathroom trips, hopefully. Be careful not to dehydrate. However, as dehydration can lead to problems including headaches and urinary tract infection. Avoid alcohol and caffeine later in the day. They not only affect sleep, but also can act as a diuretic that might increase the need to go. Watch the signals. If your loved one is fidgeting, tagging at their clothes, especially the front of the pants, or generally agitated, this can be a sign that it's bathroom time. So be aware of that. Even their personality can change. They can start really being agitated, but they can't tell you what's wrong. Routine is so important. Establish regular times of the day for bathroom breaks. You want your loved one going, as I said before, every 2 to 4 hours. Most people have bowel movements at regularly the same time daily, often in the morning. And encouraging regularity is smart strategy. Establishing routine is vital in most aspects of caregiving, and toileting is no exception. Don't rush. Remember, I said you need to be patient. Going to the bathroom might take a while. Walk away or step out of the way and wait patiently for your loved one to finish. Sit instead of a stand. Men with dementia may need to sit when they urinate, especially in the later stages of dementia, when balance and falling are bigger issues. Be sensitive. Like with showering, needing help with the toilet can bring up feelings of embarrassment and loss of dignity. Some people find incontinence demeaning. Respect this and don't appear upset if you have to deal with an accident. Please don't embarrass. Act fast. Respond quickly to accidents because they can take, as I said before, skin irritation and discomfort. Gently wash and soiled areas and dry carefully. The other thing, it may be time to use protective, pull-ups. They look like underwear. There's all kinds of material out there, covers for the bed, etc. But I really feel that as I'm talking it takes a lot of time. And so that's part of the whole thing. Where do you fit in all of this? Where do you take care of you? You may want to keep this person at home because you made a promise or whatever the reason might be. And it's okay if you can manage it, kudos to you. And I would encourage you to continue. And if you have any other tips for us that you yourself are sharing, I'd be very happy to hear. But I do want to talk about the emotional impact on caregivers. Can we go to the next slide, please? I can very well imagine what caregivers are going through. They may face several difficulties when dealing with toilet problems and incontinence. It's an emotional impact on the caregiver on top of everything else that you do. So caregivers may feel frustrated, as I said before, embarrassed, overwhelmed, dealing with accidents, messy situations repeatedly. It's not a pleasant thing to have to do. There could be communication challenges, figuring out whether the person needs to use the bathroom, helping them understand instructions, can be texting due to the communication barriers caused by the dementia. Privacy and dignity, balancing the need to assist with toileting while respecting the person's privacy and dignity can be challenging. Not easy, I have to tell you, not easy at all. Personal hygiene, ensuring proper hygiene after an accident or helping with bathroom tasks can be physically demanding and emotionally taxing. Some people cannot tolerate it. It's too difficult. And it's okay to be honest with yourself if you're at that point. Caregiver stress, constant vigilance required to prevent accidents, and the need to assist with toileting can contribute to caregivers' burnout and stress. Time management, I just spoke about it. The need for frequent bathroom breaks and assistance can, disrupt your day and your life for that matter. If you have to take them to the toilet between 2 to 4 hours every time, that's a big toll on your own personal and how you deal with your own life. Coping with behavioral changes. Behavior symptoms associated with dementia can manifest during toileting. They may refuse or they might not want to. That's very difficult to deal with. Physical demands, as I said, assisting with transfers, maneuvering in tight spaces, and managing equipment like commodes or bedpans can be physically demanding. Finding appropriate solutions, identifying the right products, strategies, and routine to manage incontinence effectively requires trial and error. Sometimes it'll work, sometimes it won't. This is another big one, impact on relationships. Caring for someone with dementia and managing toileting issues can strain family relationship and affect the caregiver's own well-being. Many times couples tell me, whoever's the one that's caring, the caregiver, Our relationship has changed. It's hard. It's a difficult thing to do. So if you're feeling frustrated, angry, embarrassed, having a difficult time with toileting, it's okay to acknowledge your feelings and give yourself permission to say to yourself, I'm doing the best that I can, but it's too difficult for me to manage. This is the first stage to getting help. You don't need to do this alone. Speak to a professional or an agency that can help you with that. And the thing is, it might be time for an alternative other than keeping them at home. And it's okay if you're thinking about that. At least it's the first step to kind of thinking and looking to see what is available for you and the person you're caring for. If we go to the next slide, one of the things that I want to kind of focus on, it's the signs of stress. How do you know if you're stressed? Okay, some of us know I'm really stressed, but I want to go over it a little bit more. As a caregiver, you might be, focused on your loved one that you don't have the time to even think about yourself. So feelings of stress really, um, feeling burdened or worrying all the time, feeling tired often, sleeping too much or not enough, gaining or losing weight, believe it or not, becoming easily irked or angry, losing interest in activities you used to enjoy, your life isn't your own anymore. Feeling sad all the time, really. Having frequent headaches or other pains or health problems can be a sign of stress that you don't even realize or recognize. Misusing alcohol or drugs, including prescription medication. A lot of caregivers, they're having such a hard time that they're actually drink a little bit more, using drugs and taking medications to sleep or whatever, and missing your own medical appointments. And we know that, that sadness, having frequent headaches and things like that. All of this is part of a stress factor. And if you even have only one of these, it's important to recognize it, acknowledge it, and get some help. Too much stress over time can harm your health. As a caregiver, you might feel depressed or anxious. You might not get enough sleep or physical activities, or you might not eat a balanced diet. All of those increase your risk of health conditions such as heart disease and diabetes. And that comes from the research. Let's go to the next slide, please. All right, so how to manage caregiver stress. We talk a lot about that. So if you've been listening, we talk about stress. The emotional and physical demands of caregiving can strain even the strongest person. Many resources and tools can help you care for your loved one and yourself. Make use of them. If you don't take care of yourself, you won't be able to care for anyone else. To help manage stress, you know, ask for and accept help. Make a list of ways in which others can help you. Then let them choose how to help you. Ideas including taking regular walks with the person that you're caring for, maybe cooking a meal for you and them once in a blue moon, and helping with medical appointments if possible. If not to take them, maybe to call and make them. Focus on what you can do. At times, you might feel like you're not doing enough, but no one is a perfect caregiver, including myself. Believe that you're doing this the best that you can. It's important to set goals you can reach. Break large tasks into smaller steps that you can do one at a time. Make a list of what is most important. Follow a daily routine. Say no to requests that are draining, such as hosting meals for holidays or other occasions. So since Christmas is coming up and New Year, remember you can't do it all. So it's okay not to host. Others can do it for you. Get connected, learn about caregiving resources in your area, and believe you me, there are lots of them, so it's there for you. There may be classes you can take. You might find caregiving services such as rides, meal delivery, or housekeeping. Join a support group. People in support group know what you're dealing with. They could cheer you on, help you solve problems. A support group can also be a place where you can actually make new friends. Seek social support. Stay connected to family and friends who support you. Make time each week to visit with someone, even if it's just a walk, a cup of coffee, or a chat on the phone. Don't isolate yourself. Take care of your health. Find ways to sleep better. Move more. On most days, eat a healthy diet. Drink plenty of water. See your healthcare professional. Get the vaccines you need and regular health screening, and tell the physician, your doctor, that you're a caregiver. Ask them for a referral if you feel that you need counseling or whatever the needs are. So, having said all that, I would like to now let's have a meaningful conversation.
We had one chat come in, Lucy. Let's see. What was it? It was that, I'm sorry. Steve, do you want to just come on and talk to Lucy?
Yes, I would love to hear from you, Steve. Oh, hi,
Hi.
Steve. I recognize you. Always have amazing questions and ideas. Go ahead.
Well, my question this morning was basically just to remind you, my wife is early stage and very functional still. Is there any value for her and for me to be discussing these things with her, or is that something that would just be a negative impact on her?
Yeah.
I know
Well,
she worries about the future, and she worries
right.
more about me than about herself. And this is one of the things that she knows can be a problem. So I'm just wondering, there's a great deal of information here, very
Yeah.
valuable. And I just wonder if I should discuss any of it with her.
Well, has she brought it up? Is she concerned about it?
No, not particularly. Um, but again, knowing her as we get closer and more, she's had one accident. And it bothered her a great deal. During the night, she woke up in a dream. She dreamt she was going, and she woke up and was going. Uh,
Yes.
and it bothered her a great deal. Yeah.
Yes. Okay, so this would have been a good opportunity for you to kind of talk a little bit about that. So, unless it happens again, or unless you're concerned because maybe you're noticing things that are different, is she managing to go to the bathroom on her own now?
Oh yeah, no problem. She, like I say, she's very functional. Um,
Okay.
very
So,
few issues,
you
mainly
know,
just at this point, memory and some confusion.
right. Personally, I'm just talking personally, I wouldn't make it an issue at this point. Why bring up something that is not there just yet? Um, but I would, if an accident does happen again, and it might very well happen, it's a good opportunity then to kind of talk about it. First of all, obviously, asking her how she feels about it. And if she says that if she wants to talk and she says, I'm embarrassed, you could say, well, this can happen to anyone. And all the things that I was sort of expressing to you. And, Steve, hearing from you from before, I know you're going to do it in a very sensitive manner because that's who you are. So I
Thank
just
you.
wanted again to thank you for all that you do for your wife. But I would just wait. What do you think?
Um, I'm prepared to wait because that's a lot easier than discussing it.
Yes, it
But
is.
I would also add that this going forward, looking forward, this is probably one of the things that concerns or scares me personally the most. The other things that are going to happen, I have a sense, be they physical or emotional, that I will be able to deal with them. This one, I'm not so sure because I know when I was changing diapers and things on our boys, um, I fled the area rather than dealing. And
You're so honest, Stephen. I so appreciate you saying what you're saying because I'm sure others are feeling exactly as you do. I have to be honest, the thought of having to changed my mother's diaper, it would have been horrifying to me, you know? Some people can handle it. The thing is, let's take one step at a time. But if, God forbid, it ever comes to that for you, Steve, it's important for you to acknowledge what you can and cannot do, and then get the support that you need at that time. But in the meantime, it seems that things are going okay. And so I wouldn't bring it up unless an accident
All
happened.
right. Thank
Thank
you.
you so much for sharing, because I'm sure others feel exactly as you do, and maybe are afraid to even say it because, oh, I'm supposed to love my wife. I'm supposed to love my mom. How could you even think about that? No, this is too difficult. And as I told you in the beginning, even the research says that is one of the things that is like, this is the cutting. This is, if they become incontinent, I can no longer do it. And it's okay. I give you all permission. I
You know,
think there was a few others on the line.
Mary Pat had an idea for Steve,
Oh, perfect.
and she said maybe get her to start wearing Depends to bed now rather than when it gets to be an issue. Just an idea.
What do you think of that, Steve? I have my thoughts about it, but I'll let you answer first.
I think before I do that, I'll let there be one more accident.
Okay, good
I
decision.
agree with you. I'll tell you a personal story because
But that,
that
may I say
happened.
that that's a very good recommendation, Mary
Yes,
Pat, and I appreciate that.
definitely
Thank you.
is. Um, yeah, when we had to do that with my mom, she was horrified. So as long as you can, keep it at bay. Thank you for that, though. I think it was a very good preventive answer. Thank you.
We have another one. It's very interesting. It's from Jose. He says, my wife is my mother-in-law's caregiver during the weekend. My mother-in-law was just hospitalized due to urosepsis. It has completely changed her behaviors and sleep patterns.
Yeah. Well, look, we know that if I'm not a doctor, so I'm not going to go into detail, but talking about, let's say, a urinary tract infection, we know you don't have to have dementia. If you're a senior and you have a urinary tract infection, you can start becoming very forgetful and you appear to have dementia until that condition is taken care of by medication. A lot of people don't realize that. So obviously, when and any health situation can escalate the dementia. You can go into hospital for even for a surgery or for anything that's minor, and your dementia, it's very, remember I said environment plays a big role in all of this. But thank you for sharing with us. It does make a huge difference.
Well, Kat has a question for you.
Yeah.
She says, how do I convince my mother to use pull-ups at night? She doesn't think she needs them, although she's having accidents every couple of nights. I think she's embarrassed, plus her incontinence is an acknowledgement that she's losing control.
I couldn't have said it better. That's exactly what it is. And it's the whole idea behind it is just to keep at it, to very gently. I mean, there's all kinds of things on the market today that really look like underwear, that look pretty. It's just don't give up. You can't give up on that. She might say no 3 times, and maybe on the fourth time she'll say it's okay. You could say, let's just give it a try. Explain that if, you'll feel more comfortable. That's why I said it's such a difficult topic because I can't just give you a suggestion that's going to work. It's try, you're going to fail. And this is why I do believe that caregivers who face dementia and incontinence need a lot of support and be able to talk about it. So I'm glad that you came on today, but this is like a one time. But if it's something that you need to talk about, please get the support that you need.
Wayne has a question. Life is beginning to have accidents mostly during the night. She has worn pads for years. My attempts to get her to wear night pads or Depends have been unsuccessful.
There you go. Yeah.
Another one.
You know, it is degrading if someone still has some sort of, cognitively, the stages are so, you could be in the beginning stage, in the middle. What does the middle mean? What is it all depends on the individual. And as long as a person still feels that they don't want to put on those depends or just pull up, it's embarrassing. It is so, so difficult to convince them otherwise. Again, patience. Maybe even sometimes humor, to talk. You know your person better than I do. Distraction to distract them, possibly. Explaining to them that you don't want them, that accidents can happen even to you. You don't, and you don't want them to be wet all night because it can affect as I said, their skin. You want to make sure that they're comfortable. Hit and miss, ladies and gentlemen.
Yeah. Well, Ruth has a
Hi.
question for you too. Oh,
Hi.
sorry, go ahead.
Somebody said hi, I think. Did
Yes.
someone say hi?
Yes,
Area
Yes,
code.
yes.
go
I
ahead.
just
Please
want,
go ahead.
yes. I just wanted to give a suggestion just from personal experience because my mom falls in, obviously experienced that with my mom. And obviously she was doing pads for a while. And yes, she started having a couple of accidents where the pads weren't sufficient. What I started doing gradually, and she would also the same thing, I don't need those, blah, blah, blah. What I would do is she would have an accident, and then for her to change, I would give her one of those like Depends, and like you said, real pretty purple and little flowers or whatever. I would give her that, and I said, Mom, you just had an accident. Let's just put this on just to avoid it. Then let's just try this. And she would wear it, and then she would go back, and gradually, it kind of sounds bad, but gradually I started doing away with her underwear and putting the Depends in the drawer with it. And now I've gotten to the point where all the underwear are gone, and then there's just nothing but Depends. And so she just grabs them. So
You know
again,
what?
it was
I
something
love that idea.
little
That's
by I
amazing.
did it little by little. It was
Great.
Absolutely.
Okay.
And then we'll go, and I'll just kind of distract her on other stuff, and we don't end up getting the underwear. But
I think that's an excellent idea. I love the idea of putting the Depends in the underwear drawer. As not right away, but slowly replacing them. I think that's a super idea. Thank you so much. Next time I'm including it in the presentation.
Okay.
Okay, sounds good. Thank you.
Thank you. We have a question from Ruth. My husband is moderately severe Lewy body dementia. He wears protective underwear and therefore urinary incontinence is manageable. He recently is having trouble getting to the toilet for bowel movements. That is a messy, difficult situation for me. It's very hard for my adult son who helps with caregiving. It is especially hard because he cannot follow directions easily and so frequently smears feces unintentionally on himself and the bathroom. Any ideas?
Oh, first of all, I have to say I'm so sorry that all of you have to go through this, including your husband. I mean, it's kind of, the whole idea is sort of to think of someone that you love doing that, not on purpose. It's very, very hard. Do I have any suggestions in this respect? I really don't, in the sense that if the person can't control their feces, someone needs to take care of that. Someone needs to clean him. Someone needs to make him feel that he didn't do anything wrong. And it's coming back to what I said in the beginning, if you remember. This situation is not for everyone. And even the ones that just can't tolerate it, it's okay. This is not this is not something we will diaper babies. We will change babies. it's difficult to do that for a husband or a wife or an adult child. So I don't have any tips on how to avoid that unless somebody else can, and I'd be more than happy to listen to that, especially given the fact that he's wearing the pens.
Right.
But then there's the whole idea of wiping themselves. You know, even if he didn't smear it all over, you have to make sure that he's clean. Bacteria gets in, and a lot of medical issues can arise from that.
Mhm.
So it's really up to you to recognize, are you able to do this, or is it time to think of other alternatives?
At least, Lucy, I go back to what you always say, talk to your doctor, talk to your
Oh, yes,
loved one's
that's for
doctor.
sure. That is a given.
They
Yes.
can refer for physical therapy, for occupational therapy. Medicare pays for both of those things. And once he refers, if you've explained the situation to him and what's going on, then the person going out there can arm themselves with the kind of tools that these professionals have learned to use to try to minimize the problems for people, if there's a way to do that. And there may not,
Yeah, they may not, but I like what you said, Evelyn. One of the roles of occupational therapists in particular, not physiotherapists, is that they are taught to look at all kinds of different gadgets and things that could assist in some way. I mean, in all my years, this particular question that comes up, it's difficult, but I do agree with you. There's nothing wrong with having an OT come in and assess the situation, possibly. I think there was another question.
Yes, Donna wanted to know, my father had this issue of being able to access his pajama pants. We found that a nightgown that opened in the back stopped all that. So,
Oh,
suggestion.
wow. Okay, thank you for that. Any
I love it.
suggestion is helpful. Any suggestion is helpful for
Right.
sure.
And Minerva says one thing that my mother has started to use to help her is wipes that are flushable. She found them when she was hospitalized for a while.
Yes, there are flushable, the ones for babies are not flushable. You can have a disaster in your toilet. But there are Depends. It's called Depends here in Canada. I don't know, there must be the same in the States. And they are wipes that are already wet and not very gentle, and they can be flushed in the toilet. So thank you for that. That's a very good suggestion for someone who still can do their own hygiene, but it's a much easier way of doing it.
And here's probably your last and most serious question of the day. Jose says, when is it okay to say to oneself, I can't do this?
That's what I've been trying to do with this whole session. I
Is
talked
is
about
nursing home better? Yep.
yes, it's okay, and I personally give you permission because I'll tell you why. Not only is it beneficial to you not to do this, but it's going to be beneficial for the person you're caring for. Because I've seen situations, as good a person as you are, as much patience as you can get upset with the person that's doing it, even if you know that they're not doing it on purpose. You're only human. So you want to avoid that at all costs. So it's many times better for the person you're caring for to be in a place where this is part of their job, and you can visit and be with them and have quality of life that you deserve for both of you. This is a difficult, difficult situation, but yes, you have all the right to say, I cannot do this any longer. And I respect you for that.
Okay, let's see. Donna says, for my neighbor, we looked into the Pure Wick system, which is very expensive, but it's an external catheter they used in the rehab home. Might be able to help. pure
Well, this is why I was talking, and I'm glad you said it, Evelyn, about an OT. OTs know all these gadgets. There are gadgets that you can actually, um, I don't know why this thing isn't, okay, sorry about that. All of a sudden it came on. There are gadgets that someone who can actually, it's kind of a tube that it's attached to the person, it's comfortable, and it fills up during the night, the urine. I don't know anything about feces because I haven't heard of it yet, but for urine, there are different gadgets that could be used.
And if anybody's heard of it, it will be your OT.
Exactly. Your OT will know about it. Not only your OT, possibly the doctor could, and believe it or not, even your pharmacist.
Yeah, good idea. Pharmacy. They've got
So,
lots of equipment at those pharmacies.
something
Yeah.
I just thought of that you could do even ahead of time is get them used to a duvet. So at least that helps a little, and they're already used to having that. So that might be helpful.
It's a possibility. Again, it depends on the person you're caring for. If I would have suggested that to my mother in the early stages, she would not have, she was a very dignified woman, very private. And so if you think that the person you're caring for is someone that you can do that with, by all means, use any means that you have, knowing who the person is.
Right.
And you're smiling, Evelyn. Is there something?
No, it's just, caregivers get to the point where they don't know what to do. And I think talking support groups, your physician, the very things that you've mentioned,
Absolutely.
these kinds of presentations where you can talk to other people, and hear, what's been going on with them. It's so important to just try to get as much information as you can. And when you get to the position that Jose is in, I think once you start asking yourself that question, you need to take it seriously.
Absolutely. Absolutely. Definitely.
Start looking for resources.
So I think we're at the top of the hour. I know, is there one more question? Should we go? And then Evelyn, I know that you have a lot you want to say.
Think, let's see, we got two new questions. We could go on and on here. Oh, it was a thank you. That was nice. And what else do I have? I guess that's it. Yes, you got a couple of thank yous, Lucy.
Okay.
Job
Thank
well
you,
done.
everybody. I thank you from the bottom of my heart for all that you do. And
Well,
please, please, please take care of yourself. Please.
yes, we both thank you for what you do. What a hard job. And I just want to tell folks, if you got this phone number or the Zoom information from a friend and didn't get it online, please get registered. If you call our customer service person at 866-390-6491, you will get not just registered to receive the resources in these slides, which may be helpful to you, but you will also get the monthly calendar. And we're kind of a short calendar this month because of Thanksgiving, but astoundingly, in the month of December, we're going to have 4 sessions, and they're all varied, and they're all by experts in the topics. So you kind of get that little extra piece there if you get signed up, and you'll get the resources for today. So I want to thank all of you for what you do. And Lucy, thank you for your beautiful, thoughtful, and very lovely presentation on a very tough subject. And I'd like to thank the WellMed Charitable Foundation for finding people like you, to give us these kinds of talks that aren't easy, but are so meaningful. So, and
Bye, everybody. Take good care.
bye,
Hope to
everybody.
see you soon. Bye, Minerva. Thank you.
Happy holidays.
Happy holidays.